Hey everybody, just want to send a little video here to you about the benefits at a glance and the summary of benefits that come with the Humana HMO plan, the plan that we're recommending that you take a look at. So this is part of doing a video presentation, part of a compliant presentation for Humana so that we can be in good standing with the company and make sure that you get all the information you need to make a quality decision about the plan. So what I'm going to do on this little video is I'm going to go to a screen share option. So let me just click that here, and I'm going to actually walk through some benefits with you. So you should be able to see on your screen now the benefits at a glance, and we'll walk through these together and talk about the plan. Humana plan H6622-025 Humana POS. POS means point of service, which means you can go in network and not have to go to a family doctor to get reference to a specialist, in other words. So you do not have to have a referral to see a specialist. And you know, we have a fantastic network of doctors in the Western North Carolina area. And so this has been a great plan for us for the last 3 years, really. So let's just go over some highlights really quickly. Monthly plan premium is $0. Of course, you pay your $144 Part B premium to Medicare. That's a given. Everybody has to do that. This column over here, unless you're on Medicaid and Medicare, Medicaid and Medicare, this column doesn't apply to you. So for most of you, just have Medicare. No premium. Annual out-of-pocket maximum $5,900. That's the most you'd have to pay in a given year, no matter how sick you get. And a very small percentage of people ever actually reach that max out-of-pocket. Your primary care doctor is a $0 copay. Your specialist is a $45 copay. That's the same as in 2020. Preventative screenings are covered at no cost. There'll be more details about this when we do the summary of benefits, but that's like your cancer screening tests, things like that. When you do telehealth services, now this is not covered by original Medicare, but this is where you could talk to a doctor on your phone. The copay for a family doctor is $0, for a specialist is $45, urgent care is $0, and substance abuse on behavioral health is $0. So those are things you can do now online, which is a big deal these days with the virus and not getting around other sick people. If you spend the night in a hospital, it's $450 a day for the first 4 days. You could stay 5, 8, 10, 20 days and only pay for 4. So that's an $1,800 maximum per hospitalization. So even if the bill's $500,000, you'd pay $1,800. Lab tests are $0 if you use a place like Quest Diagnostics or LabCorp, which are the places that we recommend to get your labs. If you get your lab tests through the hospital or associated with a hospital, it'll be a $50 copay. Outpatient care, if you have an outpatient surgery, $400. Physical therapy at an outpatient therapy center is $10. X-rays at outpatient facility, $105. And a diagnostic test at an outpatient facility is $95. If you go inpatient for psychiatric hospital, $450 a day for the first 3 days. A specialist office visit for psychiatric care is $40. Outpatient hospitalization, $95. Partial hospitalization, $40. This is all for mental health services. Emergency care, urgent care is $35. Ground ambulance is $290. And emergency room is $90. Additional benefits. Now we have things that Medicare doesn't cover. These are additional benefits like a COVID-19 test and treatment is $0 copay. You see there. Home essentials kit. This would be things like a mask and gloves. Humana will send you a box with stuff in it once a year, home health essentials to protect you from the COVID-19 virus. Routine dental services, we'll talk more about that on the summary of benefits, and vision services as well. Transportation is pretty cool. $0 copay for 24 one-way or 12 round trips to the doctor up to 100 miles. So if you can't drive, Humana will send a car to come pick you up and take you to the doctor. Over-the-counter services is $15 every 3 months, every quarter. These are things like Tylenol, Band-Aids, aspirin, cough syrup, over-the-counter type things. Silver sneakers, gym membership is included. A well-done meal program is included. That'll send 10 frozen meals to your door after a hospitalization or a skilled nursing stay. 10 frozen meals so you can recuperate without having to worry about cooking. And then routine hearing is covered at no cost for, there is a cost for hearing aids, but additional costs may apply. We'll cover that more in the summary of benefits coming up. For prescription drug benefits, $215 is a deductible, but only on tier 4 and 5 medicines. So your generics and name brands, no deductible. All right. And then at the retail store, your copays, as you can see here, 2, 8, 45, 95, 90-day supply. But mail order, that's the sweet spot. If you do generics, tier 1 and 2, 90-day supply mail order, a lot of you do this, and we recommend it, no copay for generics, which is phenomenal. And a small savings on name brands and tier 4 drugs through the mail order program. So we want to switch now and look at the rest is disclaimer lingo. We want to switch now and look at the summary of benefits for this plan. And it shows the available counties here. That should be a county listed where you live, your primary residence there. So again, this is a lot of details, a lot of lingo. So just kind of hit the spots that we need to talk about here. To be eligible, of course, you have to be enrolled in Medicare A and B and live in the service area. And the plan name, how to reach us, there's phone numbers. You're going to get a book like this. You can get it digital from us or in the mail from us. So you'll have all of this and you can look it over. Here's where your premium and deductibles are. $0 premium, of course, you still has to pay the Medicare Part B premium, which is currently $144.60. That'll probably go up for 2021, but that's the case anyway. There is no deductible on this plan. Tiers 4 and 5 on the drugs have a deductible, and again, $5,900 out-of-pocket maximum in the network, and your copays count towards that $5,900. That's not a deductible. That's the most you have to pay. Remember that. That's a big difference. Here's where it talks about hospital care, $450 a day, no copay after days 4. Outpatient coverage for outpatient hospital, $450 copay, or at a surgery center is $400 copay. Doctor visits, again, 0 for family and $45 for specialist. Next page. These are preventative benefits that are covered. You remember I mentioned a mammogram and a prostate test, these kinds of things. This is the listing of all the different things that you get in preventive screenings for no copay. Again, emergency room 90 and urgent care 35. We talked about that. Diagnostic and lab services, mammography 45 to 75 copay, radiology 100 to 120, lab services 0 to 50. That depends if you do a freestanding place like Quest or LabCorp, or you use a hospital. Remember, that's going to be more through the hospital, $50. Diagnostic tests and procedures, outpatient x-rays, radiation therapy, all these are covered on your plan. For hearing, there is a hearing exam for $45. You also get some fitting up to once a year for no copay. There is a $690 copay for advanced hearing level aid, 1 per ear per year, and a $999 copay for a premium level hearing aid up to 1 per year per ear. So I'm not going to make a comment on the quality of these hearing aids. You can check that out for yourself. My dad has some hearing aids, but he got the more expensive type that wasn't included here. Dental coverages, a Medicare covered dental service, of which there are not many, would be $45. And then you're going to see right here, 0 copay for all of these different services. Again, you'll have this book, but here's the key. $2,000 combined maximum benefit coverage amount per year for the preventive and the comprehensive benefits. Preventive meaning like your cleanings and regular x-rays. Comprehensive meaning everything is covered outside of cosmetic, up to $2,000 per year. In network, out of network, you're also going to see, if we scroll on down here, $2,000 combined sufferings, but their coverage, $2,000. There may be some limitations out of network in terms of the pricing, but you're still going to get up to $2,000 of benefits in or out of network, which is phenomenal. Vision, a Medicare covered vision exam for $45. A diabetic exam is 0. Glaucoma screening 0. Eyewear after cataract surgery is 0. Then the $100 benefit for glasses or contacts is within the Humana Vision Network, that you'd have to use that Vision Network. Like Lens Crafters is a place that uses the Vision Network with Humana. So you get $100 off of glasses right there. Mental health services, again, $450 a day, days 1 through 3, no copay after that, up to 90 days. This is stuff, again, we covered in the benefits at a glance. This is the more detailed. Skilled nursing, days 1 through 20, 0, just like Medicare. Then 184 days for days 21 through 100 after that. The good thing about Humana Plan is it does have that max out-of-pocket limit. So if you did go into rehab for longer than 20 days and had to start making copays, you would hit that out-of-pocket maximum, which would include any hospitalizations or doctor visits that you had. So you are protected by the out-of-pocket maximum, which on Medicare, you're not. You could pay the whole 80 days 21 through 100 if you just had Medicare alone. Physical therapy, $10 to $40. Ambulance, again, $290. Through the air, an ambulance is 20% of the cost. And transportation, zero copay for 24 one-way or 12 round trips to the doctor up to 100 miles per trip. Then we get back into covering your drug benefits, as we talked about. The chemotherapy drugs and other Part B drugs, those are drugs that are administered in a doctor's office. That's 20%. The $215 deductible for tier 4 and 5 on your drugs. And then it explains the initial coverage limit. When you get to $4,130, then you get into the coverage gap. But here's something that's really cool. We showed you the copays earlier, but let's get down to, and that's if you have extra help, the extra help program. You're not on Medicaid, but you get extra help with the cost of your medicines, and that's based on your income. If you qualify, you can talk to Department of Social Services to see if you qualify. If your income is limited and your savings are very limited, you can possibly qualify for these rates. You have to call DSS for that. We can't give you that information. But here's something that's really cool. This is a new thing for 2021, coverage for insulins. See that right there? Insulins. You pay $35 copay for 30-day supply, 90 days, $105. If you go through Humana mail order, $35 copay and $95 copay, a little bit of savings there for a 90-day supply through Humana Pharmacy, that's mail order. But watch this, insulin. If you're type 1 diabetic and you take certain insulins, and there's a list, you'll have the book, there's a copay of $35 the whole year. Doesn't have a deductible, doesn't have a donut hole, doesn't have a coverage gap. It's $35 a month for insulin related products all year long. So that's a phenomenal extra thing that's been added this year by the plan because of the federal government made some changes. So that's something that type 1 diabetics are going to be pretty excited about. Then of course the coverage gap for everybody, there's a discounted price in the coverage gap until you reach $65.50, in which case you would get out of the donut hole and into what's called catastrophic coverage and only pay 5% of the cost of your drugs after that. So additional benefits, Medicare covered foot care, $45, chiropractic services, Medicare covered, again, $20 copay, medical equipment and supplies, that's 20%, durable medical equipment, hospital beds, walkers, oxygen, 20%. Rehab services, $10 to $40, we talked about that. The telehealth services, there's the details on that. Again, that's talking to a doctor on your cell phone, telehealth. That's a pretty good deal. And then more benefits for your plan. We mentioned the COVID-19 testing, so you can get a test and treatment for zero copay. The health essentials kits, they will mail you some masks. A lot of you have already gotten that this year. If you're already on Humana, if you're new to Humana, you're going to get a mask. I believe there's gloves in there, a box of things like that. Well-done meal program, 10 meals delivered to your door after hospitalization or skilled nursing stay. Over the counter, $15 every 3 months, as we mentioned. And then Silver Sneakers Fitness Program, which is a phenomenal program. Everybody that goes to the gym loves it. And if you don't go to the gym, you go to the gym because you got a free gym membership, and that's pretty cool. So if you want to find out more, there's websites that you can use to search out the details of your specific drugs and everything else. So with that, we've enjoyed sharing this quick video here with you today. If you have any other questions, write them down. You might have to watch this a time or two. Write your questions down and we'll be happy to answer them, and then watch our video on how we can help you apply for this plan safely, high tech, low tech, and no check. Watch the video on that. Appreciate you guys. Have a great one.